Hello everyone. Today, we're diving into the world of a medication called fluconazole, commonly known by its brand name, Diflucan. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fluconazole, recognized by its brand name Diflucan, is an antifungal medication that belongs to the class of drugs known as triazole antifungals. Its primary function is to treat and prevent a variety of fungal and yeast infections by inhibiting the growth of certain types of fungi. Initially approved by the FDA in 1990, fluconazole is used to treat infections such as candidiasis, thrush, of the mouth, throat, and esophagus, as well as systemic candida infections, which can affect the bloodstream and internal organs. Additionally, it is prescribed for the treatment of cryptococcal meningitis, a fungal infection that affects the brain and spinal cord, particularly in individuals with weakened immune systems, such as those with HIV/AIDS. Fluconazole is also used to prevent fungal infections in people undergoing bone marrow transplants who receive chemotherapy or radiation therapy. Warnings: Fluconazole comes with its set of precautions. It should not be used in individuals who are allergic to it or any of its components. Special caution is needed for those with liver or kidney disease, as fluconazole can have adverse effects on these organs. Patients with heart rhythm problems, such as QT prolongation, should also be cautious, as fluconazole can exacerbate these conditions. It's essential to inform your healthcare provider of any other medications you are taking, as fluconazole can interact with a wide range of drugs, potentially leading to serious side effects. Before taking this medicine. Before starting fluconazole, several factors need consideration. Inform your healthcare provider if you have any allergies to medications or if you have liver or kidney disease. Pregnant women should use fluconazole only if clearly needed, as there is a potential risk to the fetus, particularly with high doses or prolonged treatment. Breastfeeding mothers should consult with their doctor, as fluconazole can pass into breast milk. Regular monitoring may be necessary to check for side effects and ensure the medication is working effectively. You should not take fluconazole if you are allergic to it or similar antifungal drugs. It's also not recommended for individuals with a history of liver disease, kidney disease, or heart problems unless advised by a doctor. Inform your doctor if you have ever had any heart rhythm problems, such as QT prolongation, or if you have an electrolyte imbalance, which can increase the risk of heart issues. Before starting the medication, inform your doctor if you have ever had any serious medical conditions, including heart, liver, or kidney problems, or if you have a history of alcoholism. If you are pregnant or planning to become pregnant, discuss the risks and benefits with your doctor. Fluconazole should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. For those breastfeeding, it is important to weigh the potential risks and benefits as fluconazole passes into breast milk. Side effects: all medications can have side effects, and fluconazole is no exception. Common side effects include headache, dizziness, nausea, stomach pain, and diarrhea. More serious side effects can occur, such as liver toxicity, which may manifest as jaundice, yellowing of the skin or eyes, severe skin reactions, or an irregular heartbeat. If you experience any severe or unusual symptoms, it's crucial to seek medical attention promptly. Fluconazole can also cause serious side effects, such as liver damage, which can present as dark urine, persistent nausea or vomiting, loss of appetite, stomach pain, or jaundice. Additionally, severe allergic reactions, including rash, itching or swelling, especially of the face/tongue/throat, severe dizziness, and trouble breathing, may occur. Another potential serious side effect is QT prolongation, which can cause serious, rarely fatal, fast/irregular heartbeat and other symptoms, such as severe dizziness, fainting, that require immediate medical attention. Furthermore, fluconazole may cause other serious side effects such as kidney problems, adrenal gland problems, and severe skin reactions. It is also important to note that taking fluconazole with certain other medications can increase the risk of these serious side effects, so it is crucial to inform your healthcare provider of all the medications you are taking. Interactions: fluconazole can interact with a variety of medications. It's crucial to inform your doctor about all the medications, supplements, and herbal products you're currently taking. Some medications that may interact with fluconazole include certain antibiotics, blood thinners, antiepileptics, and other antifungal medications. These interactions can alter the effectiveness of fluconazole or increase the risk of adverse side effects. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking fluconazole. The dosage may vary depending on the type and severity of the infection being treated. For example, the typical dose for treating vaginal candidiasis is a single 150 mg dose, while more severe or systemic infections may require higher doses and longer treatment durations. Always follow your healthcare provider's instructions and never alter your dosage without consulting them. The recommended dose of fluconazole varies based on the infection being treated. For vaginal candidiasis, a single dose of 150 mg is usually sufficient. For systemic infections, the dosage can range from 200 mg to 400 mg daily, depending on the severity and location of the infection. For the prevention of fungal infections in patients undergoing bone marrow transplants, the recommended dose is 400 mg daily. It's important to follow your doctor's instructions and complete the full course of treatment, even if symptoms improve, to prevent the infection from returning. Avoid. While on fluconazole, avoid alcohol as it can increase the risk of liver damage. It's also advisable to avoid driving or operating heavy machinery if you experience dizziness or other side effects that could impair your ability to perform these tasks safely. FAQ. Many wonder about the age restrictions for fluconazole. It can be used in children for certain infections, but the dosage and duration of treatment will be determined by the healthcare provider based on the child's age, weight, and the specific infection being treated. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of fluconazole. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.